Hey, what's going on, guys? Of course, we always come to you guys each week and give you some detailed information, some type of medical topic. And today I'm very thankful to have one of my personal friends here, Dr. Kevin Kim from Evergreen Acupuncture, Inc. I'm super excited to have him here. So I will let him talk about all his accolades and all that stuff because he's a very accomplished doctor and I don't want to mess it up. I've learned my lesson about that. So Kevin, can you tell everybody, your background and your certifications and different licenses you have and all those things?
Okay. I've been practicing acupuncture in United States since 1997.
Wow.
And I came to Charlotte, North Carolina in 2005.
Okay.
And when I was in California from 1997 to 2005, I was working at University of Southern California.
Oh, wow. USC.
Yes, USC.
The USC. Okay,
yes,
cool. Wow.
I was working there. And then I decided to open my own clinic. So I moved to Charlotte, North Carolina and practiced since 2005.
Wow.
And my background is I'm third acupuncturist from South Korea.
Oh, wow.
And my grandfather taught me since I was 5.
Man.
And then my father also taught me. And I just want to explore outside of South Korea and then came to the United States and working for the hospital and then got opportunity to move here and then be able to open my own clinic.
That's awesome. So third generation, is it acupuncturist? Is that how you say it?
Yes, but in Korea we are considered as Asian medicine doctor.
Oh.
So it's hard to get in. It's like a medical school.
Okay.
Yes.
It's so funny because, I served 21 years in the military and Korea was one of the places that I always wanted to go, but I never got to go. A lot of soldiers we get stationed in Korea, South Korea and that kind of stuff, but I never got to go. So, okay. So that's a great opener, Kevin. Let me jump into the question so we don't take too much time here. Many of my clients, they have little ailments, things that bother them, knee pain, joint pain, stuff like that. How would somebody get started with somebody like you? If that's how I realized that I should work with you. I was talking to one of my buddies and I was like, man, my elbow is hurt. And he was like, have you seen Kevin yet? I was like, no, I didn't know. And so this whole time, me and you have been friends. I didn't know you were Dr. Kim. You were just Kevin to me. And so of course now I'm one of your patients and things like that. But how should somebody go about getting seen for knee pain, joint pain, that kind of stuff with you?
Well, most of the pain management we can done by acupuncture.
Okay.
But there will be some structural issues, such as long as the patient does not have ruptured disc, or ruptured organ, or broken bone, we really can help a lot.
Oh wow! Now, so it was my. We'll talk a little more about this in the interview, but it was my first time doing acupuncture. I definitely not a fan of needles, but I'm not somebody who's afraid of needles. So how do you handle anybody that's afraid of needles? Because that's a thing. I've been getting shot up for shots and all that kind of stuff in the military for 21 years. So needles are needles. But how do you approach the concept of somebody who's a little afraid of needles?
Yes, the acupuncture needle is actually not a needle. It's a pin.
Oh,
so it's not hollow point.
Okay.
Not like hypodermic needles they use in hospitals.
Yeah.
So it's thin as a hair, and then we use a guided tube, penetrate skin depths super fast, so it bypass the pain sensory. So
now this is all true. He's a doctor. Of course, he'll make it sound good. But when I went in, I didn't feel anything. I'm not going to lie to you guys. And so, kind of to bring us into focus, what we're talking about today, this is really about managing pain and pain management. Because when I had some pain in my elbows and stuff like that, I went to see Dr. Kim, and he helped me out through acupuncture. We want to give you guys different types of medical advice and different backgrounds in medicine and things like that. So you can take those things and go find a provider in your area and possibly look into that as other means of pain management. So Kevin, let me jump into my next question, man. Let's see here. So you used acupuncture for my elbow pain.
Correct.
Why'd you recommend acupuncture for me versus any other type of physical therapy?
So physical therapy usually strengthens muscles.
Okay.
So it usually works when there is a weakness or recovery from some certain ailment.
Yeah.
But if there's a lot of inflammation, especially in the ligament area, tendon and ligament, Because when you look at the structure-wise and ligament and tendons, you usually don't have the blood supply that goes into that area.
Oh, wow.
So the only way to get that good blood flow into the ligament and tendon area is actually the acupuncture, because acupuncture bring a lot of blood flow because when we put the pins in there, needles there, actually creates a lot of blood flow and increase circulations.
Wow.
And then it nourishes tendons and ligaments, so that's why the inflammation is starting to diminishing.
So when I went to Dr. Kim, first thing he did was, I told him the area that was bothering me. It was my elbow, so I have tennis elbow type stuff.
Yes.
And so mine came from overuse. So the first thing he did was he took a look at my elbow, kind of checked me out, and he saw where the inflammation was, and that's how we treated it. So I'll talk about my experience real quick. So I went in. I wasn't afraid because, of course, I know Dr. Kim personally, so I wasn't afraid or nervous. But if I was somebody who was nervous or afraid, the whole environment in his office was very calming. Like you walk in, it's very zen, very chill. And so that's the first thing. The first thing is, I if I didn't know him personally, I wouldn't have been nervous or afraid because they make it kind of zen and cool. And then when I went to the reception area, they all, were nice and pleasant and took me back and got me all set up. And then when you came in, I just, in my mind, I felt like if I don't sit there and like watch everything you're doing, I'll be more comfortable. And so I didn't. You put a little towel over my eyes and told me to relax.
Yes.
And I mean, it really was relaxing. I fell asleep, actually. I fell asleep on the table while I was doing the treatment. So when I was getting my treatment, Dr. Kim, what were you doing to me? So again, I had elbow issues. So when I do weight training and things like that, I have elbow pain. So I kind of wanted to get seen for that to make sure, I'm doing my due diligence of taking care of my body. And so what did you treat me with that day, Dr. Kim?
So the first thing, I had to get examination on your elbows,
That's
see where
right.
the problem was. And then I applied the healing cream. Healing cream is my grandfather's recipe that has a lot of chicory root.
Okay.
So that actually helps the area get ready. Like bring good blood flow, bring down a little bit of inflammation.
Yeah.
And then we were inserting needles using guiding tubes.
Okay.
First few around the muscle area that works on the elbow.
Yeah.
And then few into where it was the affected area.
Okay.
And then we have something called a micro acu stimulator. They use a micro current.
Wow.
So we hook up your needles into that machine and generate some current.
I felt like something was going on when I was laying
moving there. So
because I promise you guys, I did not look. I was like, if I don't look, I didn't see anything. So when I woke up and Dr. Kim and his team took the needles out, I didn't see nothing. I wasn't paying attention. I was just like, whatever you do, you do. But you just talked about something, Dr. Kim, that I want to kind of highlight on. When I walked into your office, your wife gave me a tour of your office.
Yes.
And there were some things about you I didn't know. I didn't know that you make your own medicines and you put together your own things. And like you said, you're a third generation, doctor being able to do that. So let's talk about your healing cream and your all natural things that you do for medicine.
Yes. My grandfather left a pharmacy book.
Oh, wow.
To pass down to our family. And then one of the foremost best product he ever created, actually two things. One is a healing cream, one is derma cream.
Okay.
The healing cream is consists of a lot of chicory roots, some peppermints, and some licorice and some other herbs in there.
Okay.
That invigorates blood flow.
Oh, wow.
And then as long as the inflammation is not coming from the structure of the bone, or the soft tissue issues, it can really heal.
Wow.
So, for example, if you start applying to where you had bruises, bruises will disappear super fast, about 4 or 5 times faster than normally it gets healed.
Now I gotta tell you guys though, because Dr. Kim is modest, he don't talk about this stuff. But people buy this healing cream that his family recipe. They buy it like crazy, and these are things I just didn't know. But they buy these things because you sell. If you're not somebody that can actually get to be seen by Dr. Kim in person, you can actually buy this healing cream from his practice. So we'll talk about that. I'll make sure I post that after this. So if you're somebody you're interested, he puts all the ingredients on there. Of course, you're not gonna get the formula, but he'll put the ingredients on there so you know actually what's in there. But yeah. So the derma cream and the healing cream.
Healing cream, yes.
So what's the derma cream?
Derma cream consists of some aloe plus Yuxingja. Yuxingja is a special herb that grows in the ocean.
Okay.
And they found it a couple thousand years ago. They was working on a lot of skin issues. So, for example, people who had psoriasis, eczema, even with the people suffering from the shingles.
Okay.
And the rosacea. So it really helps to heal the skin to regenerate fast enough. So it overcomes the problem of those skin issues.
Yeah, I've been using the derma cream. I have eczema, and so I'm using the derma cream on my eczema. My face is looking pretty good. I ain't gonna lie, because it's all natural stuff. And as you guys all know, I'm a all natural kind of guy. I don't bash any kind of anything, but I try to use natural things first. Those natural things don't work, then I try to go more of the medication and chemical route. But definitely try the natural things first. Once again, no bashing, but try those things first. Okay. So is there any other medicines you make, Dr. Kim?
Yes, so we have a whole pharmacy in our clinic. We have the herb dispensers that consist of 500 different herbs.
Oh, wow.
So we can make herb from treating seasonal allergies all the way up to like any types of a disorder in endocrine system. Yeah. And fertility cases. We have a lot of couples have healthy babies.
Oh, wow.
Over 2050 success case in fertility cases.
Man, so let's talk about that, because I have a large population of women in my group. So what types of things would you do for fertility or to help with fertility?
Okay, fertility cases usually happens with a few different reasons.
Okay.
Like hormonal issues, structural issues.
Okay.
And it can be also due to some issue in the men part.
Oh, wow.
So when they
fellas, all right, yeah.
So when they come, they've already visited to the fertility clinics.
Okay.
So they know what the problem is. They come and they discuss it with us.
Wow.
Or they just want to go with the natural route without trying anything else. They just come to us, and then we have our way to diagnose what's going in their body as well.
Oh, wow.
So, and when somebody coming from the fertility clinic, so they are going through some fertility clinic treatments.
Okay.
Then when we combine with us, the success rate is over 99%.
What?
Yes.
So okay. Let me make sure, because you know people gonna watch this, and I gotta make sure they know. So they start out with the fertility clinic. Okay, the normal progression. You're having trouble conceiving. You start out with the fertility clinic, and your natural ways of trying to help the couple, just bolster that. It basically takes your chances up. So these are things that I didn't know. So again, guys, take this information. Go seek your own provider. Go seek your own. This is knowledge. This is not medical diagnosis. So go seek your own doctors and talk to them about what you hear here and get your own medical advice. But I mean, these are definitely new things that I didn't know about. Especially, this is my first time doing acupuncture and getting some natural medicines for pain and that, because I've been using icy hot and all kind of other stuff for pain, but getting natural pain meds that, or pain creams that I can look at the container and know exactly what's in it. I mean, because I have eczema, so I can't put everything on my skin or I'll break out. And so just knowing that everything that Dr. Kim had in his, pain meds were all natural was really big for me. Man, that's really awesome. Is there anything, because I didn't know about the fertility thing. So is there anything else that you really specialize in?
So, generally speaking, half of my clinic runs on pain management, but the other half can be from thyroid issues. Ladies that has to go through menopause.
Oh, whoa! Now, hey, we dive into menopause. It's gonna be 1,000 questions. Okay, so I can't, because you said that menopause word. Now I can't skip over it. So what types of things do you do to help with menopause?
So menopause is they're having imbalance in their decreasing of lady hormones, different parts. So body doesn't have to feel those symptoms like hot flashes, night sweats. So we can make that transition more smoothly without introducing any types of hormones. Body can regulate itself.
With just natural things.
Yes. With acupuncture, herb does not matter. It works either way. Yes.
Hey, listen, Dr. Kim. Now, that's going to be a hot topic. I'm telling you, we have a lot of ladies, and menopause is a hot topic. So look into that, ladies. The natural, if you have is the term an acupuncture doctor? What's the official term?
So they have to look for licensed acupuncturist.
Okay.
But if they have certification in the Oriental medicine, from national board.
Okay.
That's what they have to look for. They are very qualified.
Certified in Oriental medicine.
Yes.
So listen, that's the tip. You can seek out somebody who's certified in Oriental medicine, acupuncturist, and talk to them about these things. Or your primary care physician, they may know about it. Or you can seek out those acupuncturists or Oriental certified medicine doctors. And man, that's really cool. Because I deal with this stuff all the time. We have ladies that are going through menopause, ladies that are trying to work on getting their bodies right so they can conceive. So there's so many natural things out there, other things to try that people may not be aware of. And so that's the key topic here today, guys. We want to talk about just different ways and different things to look at for you to take that information, not take this as, again, I got to say these disclaimers. We're not giving you medical advice. This is just general information you can then take with you to your local physician, your local acupuncturist, your local Oriental certified medicine doctor, and talk about these things. Pain management, menopause, if you're trying to conceive a child. These are things that you may have options that you may not know about. Okay. Dr. Kim, this has been great. How can, if somebody's in the Charlotte area or they just love hearing what you talked about and they want to travel to Charlotte.
Sure.
How can they get a hold of you and your business?
Well, you can call our front office.
Okay. What's that number?
It's a 704
okay.
540 7471.
Okay. And I will also post a number as well. So you heard it here. I'll also post it. Okay. Do you have a website, Dr. Kim?
We do have a website. It's evergreenqi.com.
Okay. I'll make sure I post that too. And Dr. Kim, is there any preventative thing because I can't leave without doing that. We're talking about pain management. Let's talk about pain prevention. Is there anything that my clients and those other people that will listen, because we're going to broadcast this out on YouTube as well. Okay. What preventative type things do you recommend as well? So for me, I got elbow pain. I don't know when to stop. I don't know when to take a break. So what would you recommend? So let's use me as the patient here, because I'm literally one of your clients. But for my elbow pain, for overuse, what would you recommend for me to do in preventative?
So prevention wise, when body having pains, that's already telling, it's recognizing your problems and its body's telling you to not to do those moves anymore. So, so always listen to your body.
True.
Okay. Always listen to your body. And then when you do a lot of workouts and like your case, make sure you take some good supplements. Okay. Preventive supplements helps. And also stretching is very important.
True. I don't stretch enough. Yes, I'm guilty.
And then plenty of waters.
Plenty of water.
Plenty of waters, stretchings, and also proper trainers.
That's true. Hey, proper train. That's a key. That's a plug for me. He didn't even know he was plugging me because I got experience. But that's a good point. Yes. That's a good point.
And then there's a lot of you can seek for advice. Like there's a lot of modalities out there that helps people to more prevention wise too. A lot of people comes to us, like for example, some professional athletes, they comes to us before the game or before the season start. They do something called tune-ups.
Oh, okay.
So a lot of people come. We do a lot of cuppings and a lot of points in their whole body.
Okay.
They help to loosen that up.
And it's good stuff.
I always tell them take a little bit of something or stay away from anything that causes inflammation in your body. So I usually give some diet guidelines as well.
Okay, that's good stuff. Yeah, because I mean, if you guys are not a part of my program, I'm really big on anti-inflammatory foods. I just feel like inflammation is just wrecks the body. And so you want to try to bring down as much inflammation as possible. And that's what Dr. Kim just said. Yes. You want to reduce as much inflammation as possible. Well, hey, guys, I don't like to make these too long. I'm sure I'll get a whole bunch of questions about some specific topic, and I'll have to ask Dr. Kim to come back. But this was a great interview, Dr. Kim. I appreciate you. Again, I'll make sure I put all of his contact information on there. If you're curious about coming to Charlotte and seeing him or being one of his clients, if you're curious about any of his derma creams or pain management creams, you definitely can get those things on his website. But again, I don't bring anybody on that I don't personally either see I'm being seen by, or I know that is a really good doctor. And Dr. Kim is a very, very good doctor. So hopefully you take this information and you're able to go and use it to find other ways to treat pain or fertility or menopause. But Dr. Kim, anything else you want to say before we close?
I also appreciate Jeff for giving this opportunity to speak as well too. Thank you so much.
Of course. Yes. Hey, I always want to make sure that things that I find out, that I learn, that I'm finding ways to share those things with my clients as well. Awesome. Dr. Kim, thank you, my friend. I appreciate you.
Yes.
Good stuff. Thank you.